I feel really excited about the opportunity we've got to transform the system. With Hei Ara Oranga, over 5,000 people committed their voices, their emotions, their energy, told their stories about what needed to change for mental health and addiction treatment and services in Aotearoa. So we want to capture that in moving forward with transforming the system. We have an opportunity for change and there is no better time to do it, and thank the government for getting behind us in the endeavour to make change. So the top priorities for us: co-designing services with those people who need to be involved, people who use them, their family whānau, practitioners in the wider community, particularly working with Māori. And we have 3 distinct pieces of work that we are commencing with. That is a suicide prevention framework and action plan. We are getting on with that work. We have heard through the inquiry process that suicide is a big concern to our community, and this is not just a health response, it is a wider response to support communities in understanding how to support someone who may be in distress. The reform and repeal and replace of the Mental Health Act. So that is work that we are also starting immediately, and as well as thinking about changes in policy for the Act, it is about what we can do now to operationalise the use of current legislation. We are seeing too many people be under the use of legislation to get treatment, and there are things we can do immediately to support a different way of those people being supported. The third piece of work is on the establishment of the Mental Health and Wellbeing Commission. So that is work that we will commence immediately and give advice back to government in June. You know, we know that there are huge expectations about change. That is not going to happen overnight. We do have some challenges with having a workforce that needs to grow. We need to build our capability and skills. And this is not just in health, it's right across government agencies and also in our community. Many of the stories that people told were about needing more immediate help and the right sort of help, or being able to help themselves. So there is something in here about not necessarily people being referred more to specialist services, but being able to help themselves at home or wherever they may be, where they're calling out for something different.